You're watching TV9 Digital. I am Adarsh Vepachedu. COVID-19 cases across the country are skyrocketing. Why is it happening? We seem to have forgotten our 3 mantras to keep COVID-19 at bay. Number 1, wearing masks properly. Number 2, following hand hygiene. And number 3, social distancing. We now have a new weapon in the form of vaccine. But it is because we are not using our weapons against COVID-19 that there is a rise in cases once again. People are flocking markets in large numbers, most of them not wearing their mask, or even if they have one, they're not wearing it properly. With the cases rising once again, authorities are resorting to levying fines. For instance, in Nashik, 5 rupees is being collected for entry into a market to avoid overcrowding. In Mumbai, authorities are carrying out tests without the public's consent. Airports and airlines are banning passengers for repeatedly violating COVID guidelines at airports and in flight. So why is this the case? Why we as a people simply cannot be responsible enough and adhere to COVID guidelines for our good and the larger good? And more importantly, are hefty fines and jail the only deterrent? I had a word with Assistant Professor Tila Kumar of the Department of Sociology, University of Delhi, to try and understand the full picture. I asked him if herd mentality is costing us too much. We felt the worst has already passed us and now the cases are rising, but we feel COVID-19 is not going to happen to us. What is the reason for this mindset and how can we change it?
There are different reasons why people are violating these rules. One can say that these people are also not of one particular kind. There are many kinds of people who are violating and in different ways. One can say that it's of course more than a year that we all have been trying our level best to follow the protocols in our own ways. But there are also people who are habituated with violating the rules either of the society or that of the state. So there are those who are habitual violators. So that is one kind of people that we can think about, those who violate any kind of rules that have been put to force upon the people. Second is that people probably at the beginning tried to follow the protocols sincerely, but now that we have already gone through more than a year, so people probably try to see that how long we can actually follow the protocols. I would suppose that there is always a different strategy that we should be following. One is, of course, state punitive measures. So we talk about how either the police enforcement or the enforcement agencies are working, including financial, penalties. But that is not probably the solution that we can think about. Probably it will be better also to have community level or at the level of society or civil society bodies, or we talk about residential welfare associations, or if we talk about the municipality level, local government institutions, including non-government organizations, who should come forward to at least spread the message. Although we talk about the message being spread almost by professional doctors, including government representatives, leaders, but probably it will be much more effective if people at the local level, their own teeth and kin, their own immediate representatives are also put to task.
I then asked the professor if he feels intense steps such as levying fines are the only ones that will work, because we are having to resort to that once again.
The repercussion of the implications of not following these protocols have to be graphically, presented and also explained by the local, either leaders, the civil society organizations, the non-government organizations, including, if we can say, community workers. Probably, in addition to the enforcement agencies that who are already doing their lot, these communicating the seriousness about the issue of the violation of these protocols will be going a long way. There are also people who have been playing with, trying to say how they will follow it the next time, but they were just actually coming for something urgent, and So there are different ways of explanation that people would give for any kind of violation, but probably I would say that penalty in monetary measures is way definitely which should be there. I do not have any second thought about, but there should be also many more ways of explaining the ill impact of not following this protocol.
What about the government's role? Awareness drives seem like a distant reality, and ironically enough, we have hectic political campaigning with thousands of people not wearing masks without any social distancing. How much of what is happening right now in terms of rise in cases the government's fault?
People know it very well that there is also the political aspect to it, and on the one hand we're talking about everything being closed, either school, colleges, and including the market for the sake of the people, and probably when we're talking about digital India and almost everything going virtual, we can also the government should also think about alternative ways of either campaigning or reduce it to the number of, there were directions about either attending to funerals, attending to marriages. I think that government should also think about, if at all there is a physical rally, the limit of the number of either the members of the rally should also be drastically down to a reasonable number, or if there could be different ways of altogether mobilizing people in alternative media. Also, we are talking about these political leaders for whom the people who are out there in the rallies and campaigning, they are near, numbers rather than people, because their lives are put to risk. On the one hand, they are crying crocodile tears for the sake of the people in the rally. But if at all they were very, very serious about the people and their lives, probably they would think about alternative ways of mobilizing these people and thinking about political mobilization. So probably vaccination should be carried on in large numbers in these states rather than mobilizing people for these political values. And consciousness campaigning should be organized for vaccination and COVID protocols, etc., rather than this political mobilization.
Bottom line really is, it is in our hands. Wear your mask properly, practice hand hygiene, and ensure social distancing. This is what we can do to ensure things don't go from bad to worse. If you've liked the information that I've shared with you, make sure you like and share this video, and yes, subscribe to TV9 News on YouTube, Facebook, Instagram, and Twitter. Until next time.